I own and operate 4 urgent care centers and a wellness clinic as a separate company. I have a private surgery center, and I have an on-site medical company that's in about 20 states. Everything that's playing out, and it didn't make sense to me. And I went through Ebola in Africa. I went through H1N1 in the Middle East. When you do anything in the scientific method, when you do anything in science, when you do anything in research, you come up and you have what we call a hypothesis. You have a statement that you think, I think X is going to be X. And then you test that statement, or you gather data points against that statement. Then you look at those data points and you reevaluate, was I correct? Was I wrong? And how do I adjust? We also have to look at history and experience, because I think that's the biggest fault in our country today is we whitewash history. I guess we digitally whitewash it with the mainstream media. And the absolute truth here is this, yes, this is a horrible problem. And no one is saying it's not a horrible problem. I think our president, what he's done so far, in my lifetime, I can't imagine anyone else doing as good a job as he has. And I've watched other presidents go through this up close. And I think that this president was on top of it from day one. And if you want to think about the stress he was under, can you imagine when Nancy Pelosi was handing out pins, he was actually using his pen to sign a travel ban to China. And he was staying focused with his hand on the rudder while the rest of the country was losing their, minds, saying impeachment, which we all know didn't make any sense. And I'm not being political. I'm just looking at the facts that we have. But We did know one thing. We knew there was a bad virus coming from China. We've had reports out. Some go back as far as October, November. And we knew something was coming. So this is not a one-off. I bought from my clinics 6 weeks ago. I bought 4 months of supplies for my clinics based on the data that I was seeing. Not sure what was going to happen. And so when I see hospitals that are screaming right now saying we don't have X, Y, and Z, I would just look at them and go, why? This is not something that just jumped out. Dr. Fauci, I don't think he's providing all the evidence to the president and giving him a complete picture based on their own website. This is not my opinion. This is the fact that I have the ability to read. On its own website, it says don't shelter in place unless you have X, Y, and Z. Yet they're recommending everyone stay home. And then you look at the media we have this young patient here, we have this kid here. Right. Those are anecdotal. And I'm not saying that they're not affected, but from studying the actual gene sequencing on this, from studying the actual pathophysiology of this virus, it appears it attacks lungs that are producing endothelial cells to increase oxygen carrying capacity. So there's a subset of people in this country that may have underlying chronic lung disease, not even know it yet, even young people. Or you have young people that are morbidly obese and have what we call Pickwickian syndrome. They can't take as big a breath because their body habitus won't let them do it. And so their lungs are compromised. And we're not talking about those folks. And I think we're doing a disservice to those at risk by telling everyone, stay at home, because you're glossing over the folks we need to be paying attention to. You're increasing panic, making it a panic-demic. So we're in allergy season where everyone has a dry cough and a scratchy throat. Mm-hmm. They're flooding the ERs instead of someone coming out and go, look, all our studies show the majority, 90+% of patients will be patients that are older with comorbid conditions.
Right. Can you just, for our audience, define what that comorbidity
Comorbid
means?
conditions would be obesity, diabetes, coronary artery disease. Anyone
so otherwise compromised.
Yeah, compromised. Smoker. A lot of smokers. I mean, everyone goes, well, look at Italy. We're going to get ready for Italy. Comparing the United States situation to Italy is like comparing a grape to a hand grenade. I mean, neither one of them make any sense. Tell everyone, look, this is spreading like wildfire. Here's our modeling. Of course, the modeling they're giving us doesn't make any sense because we haven't seen it in any country that has it. But they're telling us we're going to have millions.
There's two things that people need to take away from them if they live through this crisis. The first is you're getting visited by the ghost of socialism future. The spirit is showing us the things that might be, not that have to be. But with shortages, with centralized planning, with people panicking and hoarding, with people turning on one another in grocery stores and elsewhere, and with the constant uncertainty and fear that occupies our conversation, this is what socialism looks like every day. Forgive me for interrupting.
Well, the evidence is showing us they're wrong. We don't have bed shortages. We don't have ventilator shortages. And don't say anything about New York, because New York had a problem that goes back 20 plus years because they have one hospital for every 117,000 patients. There's article after article back in 2017 and earlier about the hospitals they were shutting down in New York City. So any stress on a system in New York City is going to cause a stress on the entire healthcare system there. And so the other thing is you have people locked on top of each other in a confined space, watching 24/7 news tell them that the sky is falling. So they are stressed. Their bodies are dumping cortisol. If you're diabetic, you could go into diabetic ketoacidosis from all this stress. Studies can show this. It can show people raise their blood pressures. Cortisol is very damaging to the body. It also cuts down on the immune system. So there's a very big paradoxical effect on healthcare by having everyone shelter in place. And I'll put to you, that's probably why the CDC says on their website, only if you see significant community spread. So my question again is, why are we locking down all the communities when 3 states account for almost 75-80% of the cases? And they're all in high density areas where people are on top of each other. Your average cleaners will kill this virus on surfaces. Kills the flu, it kills germs, it kills everything. So clean your surfaces. Does not aerosolize on its own. It's passed in the mucus. So you can catch it if someone coughs in your mouth, I guess. So you need that social distance, which is what South Korea did. They didn't shut down their government, and so they have 701 deaths in a country of 54 million people. And they bent the curve faster than we are. So again, there's nothing out there that says strict quarantine, social distancing to radical levels is going to save anyone. Mm-hmm. And there's a lot of studies. One came out of the University of Texas a while back that showed that you can really fend off future pandemics by making sure once it's out that people don't quarantine, because they'll develop immunity to the next. You know, the flu, let's put this in perspective. Last year, using the low numbers, we had 60 million people with the flu, 270,000 plus hospitalizations for critical patients, and anywhere, looking at the numbers again, between 15,000 to up to 42,000 deaths. That's the flu from the same time this year. Why are we telling people in crowded cities and cold climates that they have to respond the same way folks do in cities that are not crowded and not stacked on top of each other in warmer climates? We're not addressing all the factors. What we're addressing is the fear. They're trying to push a narrative and a hysteria. For what end? I don't know. But I do know, and I think any surgeon would tell you, we cut off feet before that are infected to save a patient. But we don't cut off the patient to save the foot. And the other thing is, I wouldn't test anyone that wasn't very symptomatic, a high-risk patient, or someone that worked with high-risk people. You're going to crater the healthcare system economically because doctors and surgeons can't go. You're going to crater people economically across the board. And people say, well, what if? But we don't know. But what we do know doesn't point in that direction. So, it's Occam's razor right now. It may be more complex. It may be something else. Outlets like the New York Times and like Vox and like Mother Jones and whatever you see, and they're parroting the exact same phrases and talking points of certain politicians and people in the bureaucrat medical community, the national bureaucratic medical community. Dr. Fauci, my understanding, has worked for the government his entire life, and God bless him. Thank him for his service. But sir, read your own website and come out and quit telling me that everything is exactly the same when none of the data supports that.
Right.
Someone's got to come out and tell Dr. Fauci the emperor doesn't have any clothes. But I think Trump realizes it. I think President Trump I think he's the best president in my lifetime, and I had Reagan. So I couldn't be happier. I'm glad he's at the helm. I just pray that we don't. I'm a pilot. We need to hit the rudder and pop the ailerons and stop the spin, because this country's going in the wrong direction.
We use the words psychopath and sociopath interchangeably, but they're not. Psychopaths are born and sociopaths are made. Is after more than 3 years of nonstop, relentless, dedicated hatred and obsession with Trump that they've essentially now turned themselves into, they're wired as sociopaths. So that's my.
And most of them are former political operatives. Journalism is dead. I mean,
It is.
Except
I
here on
think
Tamara
Mark
Leigh's
Levin's
trend
book
on.
on freedom of the press, it laid it out perfectly. I mean, you have no journalists anymore in the mainstream media, but what you do have are people that can spout and coordinate messaging and talking points. I've seen this a lot. I've seen it in Pakistan. I've seen it in other third world countries. I saw it in Afghanistan. I saw it in Iraq. When you have a press that is oppressed. I mean, it used to be the press comforted the afflicted and afflicted the comforted. But this press is part of it's an arm of the new Democrat Party. I mean, all of them are either married to, former operatives of. I mean, this is not conspiracy theory. You know, you talked about that. It's not. It's just identification of a problem.